The WITS Health Consortium and the WITS Reproductive Health and HIV Institute have confirmed receiving a stop order communication from the USAID-funded programs. This follows the US President's order to suspend foreign assistance for 90 days, impacting countries like South Africa, a major beneficiary of US aid through PEPFAR. This suspension raises concerns about the potential impact on vulnerable populations, particularly those reliant on HIV/AIDS prevention and treatment programs. So what are the potential consequences for this funding halt? Let's now bring in a Positively Alive founder, Ellen Brand. Ellen, a very good morning to you. Thank you so much for making time for us. Yesterday, during the ANC's post-Lekgotla press briefing, the Minister of Health indicating that 17% of the country's 44 billion rand HIV/AIDS program comes from PEPFAR. He did indicate that there is a meeting that was scheduled to be had with the Treasury around this particular concern. But would you say that this is an emergency that the country is facing?
It's most definitely an emergency, Alvin, and thanks so much for having me in. I think it's important to see this from a human perspective as well. Positively Live runs a support network for HIV-positive men, and many of those men are actually getting their medication through one or other of the NGOs that receive this funding. And you know, as we all know, if you think about HIV and you think about ARVs, it's not just simply take a pill and if it's not available, well, you can just wait until you find it. There's a very high risk of drug resistance. There's an incredibly high risk of people then going from undetectable to having a viral load again, which means you are actually raising the risk of transmission of HIV. And those factors should have been taken into account when one is simply pulling the plug on life-saving drugs.
Yeah.
Because the impact is going to be that you could have a resurgence of HIV, losing all the gains that we have over the last how many years, as well as you could have drug-resistant strains, which will affect Americans as much as it will affect the rest of the world, because we will go back to a situation where we have HIV that is untreatable.
Okay, and so then quickly speak to us about what the impact of this decision will be on the 95-95-95 campaign, considering as well, once again, that this is a global goal that has been set that we need to reach that level by 2030. Yes, here we are speaking about 90 days. Some may say that it's just 3 months. But you are saying that 3 months could have a major impact on the sector.
You know, it's always good to make this personal and to give an exact example. Yesterday, I had one of my members phoning me saying that in January, he was told that he's going to have to change his ARVs. So the reason is he's got having liver problems with the regimen that he's on at the moment. Now, suddenly he walks to the clinic and the door is closed and it's just got a note on saying the doors are closed, that's it. He hasn't got ARVs because he was going to the clinic to pick up his next batch. So it's 90 days that he's going to be without ARVs. Now, he can go to a government clinic, but we really need the Department of Health to make a very clear statement to these patients. These are real people. And where do they go? And you can't just walk into another clinic, because the clinic nurse, does she know that she has to actually accept this person? Because I know what's going to happen. She's going to turn to him and say, where's your transfer order? Where's your transfer letter from the clinic that you were getting it from? Well, the clinic is closed. So going to the 1990, it's 95, 95, 95, it's exactly that we will not end this epidemic in 2030 with this kind of manner in which we suddenly cut funds. And I'm not going into the politics. I don't want to go there. But there was an alternative way of doing this. Trump has every right to reassess where the funding is going and who it's getting it, and he can withdraw it. Of course he can. It's his right. But it could have been done in a way in which, first of all, there was an evaluation of the programs, and then a notice given, maybe a 66-month notice that they will be shutting them down. That would have given those clinics the opportunity to speak to their customers, their patients, and get them into another place where they could have had treatment. Just going cold turkey cutting it is totally ruining all the efforts that all these organizations, and it's not just HIV, it's of course TB and it's malaria and it's research into treatments, etc. So the whole lot is just shut down. Can you imagine that it's almost as if for whatever, and I say I'm not going to get into the political debate. It's about humanity. It's an inhumane manner for a politician to make such a decision and actually using the pawns are patients. The pawns in this political thing is the patients that are suddenly left without treatment. And the long-term effects could actually take us back 10, 20 years. So it is absolutely diabolical. I am so shocked and by the way in which this is done. And the Department of Health, as I say, really needs to act quick and send out a communication that patients can get to tell them, where do you go now? Yeah. Because we don't want people to not have access to ARVs. We must find a way of getting them into treatment and keeping them on treatment.
Yeah, and then I guess also the notice then in terms of what the response from the healthcare workers should be once a patient rocks up at the clinic or any health facility and say that the clinic that I used to get my ARVs from, unfortunately, has closed down, so I don't have a transfer note.
Yes, exactly. And, you know, the boys are scrambling. They're going to private doctors asking for letters just so that they can take that letter. So that we're trying to think ourselves as patients of how do we do this, because we know what it's going to happen. There needs to be clarity from the Department of Health, and they cannot have lekotlas. They must have a blooming press release. That's what we need right now. Something that will go to the nursing staff, something that will direct it towards the patients. We need these communications public now, not tomorrow. This needs to happen.
Yeah. And Ellen, yourself being diagnosed HIV positive, yes. Personally, at a personal level, what is going through your mind at this particular point? Sure, I know that you care for the others, but for you.
Aldrin, you know what's ironic is that I'm on medical aid. Yeah. I've got access. This is not affecting me at all. But for many, many years, I'm an activist working in the field of support for people like myself living with HIV. So I'm using my knowledge, using my own experience to help others so that they can live healthy. And I'm 65 years old and I've been HIV positive for 27 years. So I have an experience, but it's not about me. It's about people. It's about living human beings that are suddenly being cut off. And it's not a joke. It's life-saving medication. So yeah, it is a critical situation. And we're not talking just a handful. You know, in South Africa, we've got 5 million people. And yes, people will just say, and I'm seeing on Twitter saying, what's the problem? They can just go to a government clinic. Is it just convenience or what is it? It's not convenience. These were, again, also aligned to the 95, 95, 95 targets, that we should have people-centered clinics. And these are clinics that have been shut down that specifically target a specific market, such as the LGBTQ, transgender. And of course, these are the ones that you and I know, Aldrin. Do you think that they're going to get funding after this from a Trump administration? I don't think so. So I think that funding is gone, personally. So we really need to have clear direction, because must remember that those clinics don't run in isolation. They're not just NGOs. They also are under the banner of the Department of Health. Yeah. So every single time that one of those clinics opens, a Department of Health member wants to be there for photographs for the press. Oh, look how great we are. Look what we're doing. We need action from the Department of Health now. Okay. To say what, where.
A quick one in conclusion, Ellen. South Africa has been benefiting from this program for the past 20, 21 years or so.
Yes.
Do we have to rethink funding policy as well, considering that as we can see now, that this was a political decision that was taken, and political decisions are influenced by or taken by individuals that are also influenced about what's happening around them. Some people would say that, yes, sure, Trump should do this to make this particular review. But how do we insulate the sector in South Africa to ensure that we don't have a break in this transmission?
I think that you're right there, totally, Eldon, because at the end of the day, the writing has been on the wall. We cannot say that we didn't think this was going to happen. Yeah. So there should have been pre-planning, and there should have been, scenarios put in place that if this happens, we will do the X, Y, Z. We can't wait for it to actually happen. The way it's happened, of course, has shocked everybody, because nobody expected literally within 24 hours, a shutdown of all the doors. Nobody thought that was going to happen. Probably it was going to be a review, and that's what everybody would have thought. That would be the logical way to do it. So, yeah, we've been caught perhaps with our pants down, but maybe there's a lesson. That one shouldn't just put your eggs in one basket, because there are other organizations that are sort of kind of okay, because their funding is not just from PEPFAR or USAID. Their funding is more diverse, and they're able, because of that diversity, to keep certain